Okay, guys. So now we'll discuss our discussion of CBoT. So let us see our questions one by one. So first, you will try to make your answers. I hope if you made some mistakes, so this is time to rectify those. And in between, I'll tell you like detailed explanations of what are for different other options. So let's get started. So starting with the first one, 42. So first hint in the MCQ is always age. So first thing is age. So you can see age is 42. 42-year-old chronic alcoholic. Second hint is alcohol. He is taking alcohol. Present to medicine OPD with chief complaint of severe periorbital pain. Severe periorbital pain lasting for 1 to 1.5 hours. He also complained that he experienced them 2 to 3 times in a day. At the same time daily, which markedly affect. So again, next sentence markedly affect his daily activities. So by seeing the question, you will get an idea it's not tension headache, because tension headache will not affect daily routine activities. What would be the acute treatment of choice for most likely diagnosis? So first thing is you need to make a diagnosis. So what is the diagnosis for this patient? So you can see male patient first hint. Then what we have chronic alcoholic second hint. Third is periorbital or retroorbital pain. Fourth is you can notice markedly affected. The diagnosis is cluster headache. So this is a case of cluster headache. So in medicine, most important thing is you should know how to make a diagnosis. So it's a case of cluster headache. Now how you will manage cluster headache? So remember, in acute attack of cluster headache, treatment of choice will be, yes, very good, very good. That is 100% oxygen. So answer for this option B. Now let us see other options. If you see prescribe him NSAIDs. So NSAIDs we will give in tension headache. So I'm putting a T, and we can use in migraine. Triptans, sumatriptan could be prescribed. Like we can give subcutaneous sumatriptan. That is an alternative after oxygen. Even this question once came when oxygen was not in the option. In the last year INI-CET, the answer was 6 mg subcutaneous sumatriptan. So triptans should be prescribed, but that is definitely for migraine, not for cluster headache. CCBs, now coming to CCBs in cluster headache, like we have diltiazem, verapamil. These CCBs we can use, but these are for prophylaxis. Prophylaxis means PX. So I hope the answer is clear. The answer of choice in this will be provide him 100% oxygen. This is question number 1. Moving to next one. So let us see. First, I'm giving you some time to mark your answer. So read your question carefully, what you can see. So let us start with our first hint in the question is always age. Old female. 78-year-old female, known case of ischemic heart disease. So there is known case of ischemic heart disease, means she might be having angina or MI. Presented to emergency with breathlessness. So there is shortness of breath and chest pain. On examination, her pulse was irregular. So I hope by seeing many of you are smiling, because when you see this word like you don't have to see ECG, because it is clear cut telling you like it might be a case of atrial fibrillation. But let's see, vitals are unstable. So this is again a very important hint. Vitals are unstable. She is having dyspnea, so that is telling you her saturation pressure is dropping. Then she is also having chest pain. Physician order and ECG which showed findings given below. So with this ECG finding, if you notice, the first thing is it is irregular RR. Irregular RR you can notice, and you can notice when there is irregular RR, and even you cannot say QRS is easily visible, but there is no visible P wave. So when you see like narrow complex, narrow QRS, irregular RR, so it's a case of atrial fibrillation. So diagnosis in this case will be atrial fibrillation. Right? Okay, so some of you are saying like don't confuse it to be a P wave, right? It is just this wave is continuing. So if you see this clearly, this is like QRS, then this is T, right? So we cannot see a P wave here. This is like a non-clear ECG, but if you repeat this ECG maybe with some proper chest lead, then that will be more visible. Now they're asking what is the most appropriate treatment in this case. So what I told you before, remember, whenever we have a patient, first of all we need to see like this patient is stable or this patient is unstable. So in stable patient, remember what we do in atrial fibrillation, we can use any antiarrhythmic drugs. So we prefer to use like class 1 or class 3, right? In stable patient, if it is, we can use class 1, 3 class drugs. Class 1 nowadays we don't use. So nowadays the preferred modality is class 3. In class 3, what we can use either amiodarone or we can use ibutylide. So these are class 3 drugs, amiodarone and ibutilide. We can also use class 2 and 4, but again that is for OPD basis we can use. But here clear cut you can see my patient is unstable. So in unstable patient, the treatment of choice will be cardioversion. So unstable, it is cardioversion. So let us see the option now. First answer for this question will be B, will be C, cardioversion. So if you see beta blocker, can we use this? We can use beta blocker in stable cases. But again, ibutilide and imidazole are preferred. Imidazole plus anticoagulant. Imidazole again we will use in stable cases, and anticoagulant you will use after CHATS VAS score. After, so anticoagulants you will recommend after CHATS VAS score. And here in this CHATS VAS score, what you should remember, you can see like with A we have two things and S we have two things. So CHATS VAS score, it is like patient is having heart failure, congestive heart failure, H for hypertension. Then what we have age of the patient, we have diabetes. Then it is S for sex, female sex. Then we give 1 point. If it is like female, instead of female, you can see there is I can say patient is having any vascular event or stroke, we give 2 points. So if this value is more than 2, that is an indication to give anticoagulant. So in this question, you can see like there is an old female, so that is 1 point we are having. So, but again, there is not mentioned anywhere about heart failure. You cannot say breathlessness to be heart failure. She is a known case of ischemic heart disease, so that can be a reason like she can develop breathlessness because of ischemic heart disease. Breathlessness is common. So again, my patient is not in heart failure. There is no history of other things. With female also, we can say there is 1 point. Then age is having 1 point. So we should start anticoagulants, but remember first we have to stabilize the patient. So this could be the answer, but first thing is we need to stabilize the patient with cardioversion. Anticoagulants we use, but we prefer to use either I can say heparin, or we can use NOAC. NOAC means new oral anticoagulant. So we have drugs like ipixaban, edoxaban, rivaroxaban, right? Then we have dabigatran. So these are new or novel anticoagulants. So answer for this question will be C. C, that is cardioversion. Okay, so moving to next one. So let us see. Next question. Again, 57-year-old. So age is important. Geriatric medicine, many questions in medicine, they'll ask you old age people, they will be given in the MCQs in most of the cases. Chronic alcoholic. I think red is fine. So let's start with red. With a cirrhotic liver cirrhosis, was admitted to medicine ward with chief complaint of neuropsychiatric manifestation. So CLD patient is coming now with neuropsychiatric manifestation. What is hitting in your brain now? First thing should hit your brain. It could be a case of hepatic encephalopathy. So it could be a case of hepatic encephalopathy. Okay, it is given already, hepatic encephalopathy. So understand this, when it is given, don't your brain much. Let us see, considering his attention span being decreased. So his attention span is decreased, so it means I think they are asking you a question on grade. So let us see. And sleep cycle being altered. Sleep cycle is altered. He would fall under which grade of West Haven grading? So this is also an MCQ, like grading for hepatic encephalopathy is West Haven grading. So what they are asking you, understand this, grade 3, if you see, that will be severe grade where patient will have more stupor state. In grade 0, there will be no such symptom. So one of the earliest symptom of hepatic encephalopathy is altered sleep cycle, that is given. And there will be diminished attention or decreased attention span. So when you see these two things, so they occur in grade 1. So answer will be B, that is grade 1. So just try to understand this. Whenever you are having a patient who is suffering from hepatic encephalopathy, we should apply West Haven grading criteria. So let us see what is West Haven. So first let us discuss grade 0 to 1. So we also call this minimal or covert type. So in this you can see. Like patient will have mild decrease in attention, altered sleep rhythm. So this is basically grade 1. In grade 0, you will not have any symptom. If you see grade 2 patient will have like flapping tremors, disorientation, lethargy. And in grade 3, this will be stupor state. Somnolence, gross disorientation means it is a stupor state. So we have discussed this in the class also. And grade 4 is ultimately comma. So when you do EEG in this patient, so understand this thing, whenever you do EEG in this patient, in EEG what you will see? In EEG, in hepatic encephalopathy, you will see triphasic wave. In EEG, there will be triphasic wave. And understand this thing, suppose this kind of patient, sometimes there can be some gross personality change. In that case, remember, we should not give any sedative. So whenever we give sedative, what happens? We are actually increasing his stage. Suppose if a patient is coming to you in grade 2, and if you give a sedative like lorazepam or diazepam, then he can land in grade 4. So that means we are inducing, we are creating coma. So remember, sedatives are contraindicated. One sedative, if it is needed, only needed in that case you can use is that sedative is haloperidol. So कौन सा sedative आप दे सकते हो? Haloperidol. बाकी सारे sedative आपको नहीं देने हैं. Sedative, benzodiazepines, that drug, these are contraindicated. So this is, I think this was the easy one. Moving to next one. So let us see. 70-year-old man present with complaint of cough, chest pain, hemoptysis. So again, in respiratory medicine, you will see like these symptoms are common. Symptoms like it can be in TB, it can be in cancer. So again, you don't rely much on symptom in respiratory medicine. Then on physical examination appeared confused. So this is important. Whenever in MCQ they give the word confusion, you should think about pneumonia. First thing you should think about is pneumonia, common thing. Confusion with vitals, respiratory rate is 28. So which is quite okay. Bronchial breath sounds on auscultation. So normal breath sounds are vesicular. Here it is given bronchial breath sounds. So again, that could be due to some consolidation because of pneumonia. BP is low. Hypotension. Temperature is 102. Patient is having fever. Lab evaluation revealed urea of 30. Very, very important. It means it's a question. So it is a question they are asking you on CUP 65 score. So understand this, for pneumonia severity, what we need for pneumonia severity, we need to calculate CURB 65 score. So what I mean by CURB 65 score, understand this thing. C stand for confusion. C stand for confusion. If any patient is confused, we give 1 point. Simple. U stand for urea. Urea nitrogen means BUN. So urea nitrogen or we call this BUN. So if you see blood urea nitrogen, if it is increased, we give 1 point. R is respiratory rate. So when it is more than 30, we give 1 point. Then we have BP, blood pressure. If systolic blood pressure is less than 90, we give 1 point. And 65 is age of the patient. Age of the patient, then also we will give 1 point. So you have these values. Understand, when you see these values, so these values will decide where to admit our patient. So just try to understand this. If score value is like, if score value is 0, then this patient is an OPD candidate. OPD candidate means for this patient, you have to give them some macrolide like tablet azithromycin, 500 mg OD for 5 to 7 days. That's it. But if score value is in the range of 1 to 2, score value is in the range of 1 to 2, then this is the patient you need to admit, IPD candidate, and this should be admit in general ward. Okay, general ward is what we have in some government hospital. In private sector, it would be special ward, or I can say deluxe, semi-deluxe, any type of ward, means admit in ward, non-ICU. If score value is like 3 to 5 or more, so maximum value could be CUP 65, so 3 to 5 value, in that case, you need to admit the patient in ICU. So 1 to 2, I can use the word like 1 to 2, patient should be admitting where? In ward, means non-ICU. So let us see now what we have in this, in our patient. In our patient, let's go back to our slide and let's see what we have. So let me just change the color of pen and tell you what we have in our patient. In our patient, we have confusion. Confusion is there, so we give 1 point. Clear? Confusion is there. Where is confusion? We give 1 point. Urea is increased, so we give 1 more point. Respiratory rate, can you see respiratory rate? Is it more than 30? No, it is given 28. Where is the respiratory rate? It is 28, so we will not give any point. BP, if you see, BP is low, so we will give 1 point. 65 age of the patient, so again we will give 1 point. So you can see in my patient, score value is coming 4. So in this patient, you can see like score value is coming 4. When score value is coming 4, it means this is a candidate. We need to admit where? In ICU. It's a candidate we need to admit in ICU. Now understand, in ICU admitted patient, question they're asking what you will do. So let us rule out one by one. Prescribe antibiotic and send the patient to home. IPD candidate, you don't have to send him home. घर नहीं भेजना है, इसको admit करना है. Admit the patient to non-ICU, ruled out. Admit patient to non-ICU, ruled out. So admit the patient to ICU and start treatment. In old people, I told you, like if it's an old patient or a patient who have not taken antibiotic in past, we will combination of beta-lactams and macrolides, right? Or sometimes like if it is resistant to beta-lactams, then what we can do, we can use respiratory fluoroquinolones like moxifloxacin. So this is a question related to treatment of pneumonia. I hope you enjoyed this. You have calculated curve 65 score. Okay, one more score we have for pneumonia, that is called PSI index. Just remember the name, because nowadays we use only curve 65 score. So previously we were using like a score called pneumonia severity index or PSI index. Moving to next one, let us see this. During medicine clinical posting, an intern demonstrating 2 patients, Suresh and Rakesh. Suresh, this is 1, and Rakesh, 2, with provisional diagnosis of myasthenia gravis and Lambert-Eaton syndrome, respectively, right? Means Suresh is having myasthenia and Rakesh is having Lambert-Eaton. Gave 4 statements to his junior and asked them to identify the wrong statement out of them. So which of the following statement would have been chosen by the student that the intern was satisfied with the answer? Okay, so let me say here we have a patient Suresh and here I am having a patient Rakesh. So I am writing Suresh for S, Rakesh R. Now see, Suresh को क्या है? Myasthenia gravis. Rakesh को क्या है? LAMS. LAMS means Lambert-Eaton myasthenia syndrome. So if you know the difference, then answer will be simple. Okay, so Suresh means, Suresh को क्या है? Myasthenia gravis. Suresh is suffering from autoimmune disorder affecting postsynaptic membrane. True or false? So you need to choose. 4 statement, 4 statement दिए, आपको wrong ढूंढना है. So you need to answer. Simple question is they are asking you which of the following is a wrong statement. Simple, आपको एक wrong statement ढूंढना है. So Suresh is suffering from myasthenia gravis. So myasthenia, is it a postsynaptic defect? Answer is yes. So remember, myasthenia is a postsynaptic defect and Lambert-Eaton is a presynaptic defect. So पहला statement जो आपके सामने लिखा हुआ, this is a correct statement, right? So it is a correct statement, इसीलिए मैं इसको काट रहा हूँ. It is not the answer. Am I right? Rakesh is suffering from autoimmune disorder which shows improvement of symptom by evening. So understand this thing. In myasthenia gravis, you will see symptom worsen by evening. By evening, symptom worsen. And in LAMS, you will see symptom improves by evening. So in LAMS, symptoms will improve by evening. So Rakesh को क्या है? Right? Lambert-Eaton, so that is also improved by evening. So again, this is a correct statement. ये भी correct है, it is not the answer. Drug of choice for treatment of Suresh would be pyridostigmine. Suresh is having myasthenia gravis. Yes, drug of choice will be pyridostigmine. So here what you will use? Pyridostigmine. Am I right? Now in Lambert-Eaton, drug of choice will be 3,4-diaminopyridine, DAP. 3,4. So again, this is Suresh ko chal raha hai. This is in Suresh, so it's the correct statement, so it is not the answer. So by logic, fourth will be the answer. But again, for the sake of simplicity, to complete this, we should read the question. Repeated nerve stimulation of nerve done in disorder from which Rakesh is suffering will show decremental response. So understand, when you do RNS, repetitive nerve stimulation. So let me take this to the next slide so that you can get an idea. This is Suresh, this is Rakesh, this is myasthenia gravis, and this is LEMS. So understand this thing. If you do a repetitive nerve stimulation in myasthenia gravis, you will see patient will have first response will be bigger, then smaller, then smaller, then smaller, then smaller, smaller, smaller. So this response in myasthenia is called decremental response. Whereas in Lambert Eaton, you will see first will be smaller, then bigger, 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 bigger. So in Lambert Eaton, this response is called incremental response. So ध्यान से देखो, just see these two carefully. In myasthenia, you will see decremental response. In Lambert Eaton, you will see incremental response. So now let us go back to our option and let us see. Repeated nerve stimulation of nerve done in disorder from which Rakesh will show decremental. No, false. This is a false statement, wrong statement, and we need, this is the answer. Because Lambert Eaton में कैसा response आएगा? Lambert Eaton will have incremental response. It will not have decremental response. That is something which you have to remember. Okay, now moving to next one. A patient admitted to ICU has the following ABG finding. Okay, so for this you need to know the normal value. So remember, normal pH is 7.35 to 7.45. Normal PaCO2 will be 35 to 45. Now understand? So you can see pH is decreased, PaCO2 is increased. So when directions are opposite, reverse direction, so it means disorder is respiratory. Disorder is respiratory, and since pH is low, it is the case of respiratory acidosis. So let us see, my patient is having respiratory acidosis. So all the following can be cause of this metabolic defect except. So simple question they are asking you, all can cause respiratory acidosis except. So ये question के जो मतलब जो होगा वो क्या होगा? All can cause respiratory acidosis except. So let us see. Intoxication of opioid toxicity can cause respiratory acidosis. Yes. COPD exacerbation में respiratory acidosis होती है. Yes. Poliomyelitis again, this can affect your I can say neuromuscular junction. So that's again it can lead to ultimately death by respiratory paralysis. So that can be a cause of respiratory acidosis. Pulmonary edema will cause respiratory alkalosis. So answer for this will be D. Pulmonary edema will cause respiratory alkalosis. So again, this was the easy one. Moving to next. A 38-year-old asthmatic patient. So first hint in the MCQ. So again, young age is not a hint. Asthmatic patient. So asthma is the hint. Presented to medical emergency with shortness of breath and cough with expectoration. So now I will not, in respiratory medicine, I will not call symptom as hint. On auscultation, crackles were present. Again, in it's like asthma, so crackles are quite obvious. IgE is high. So this is one of the diagnostic feature. IgE values more than 1000 with CBC profile showing eosinophils. Again, classical feature. IgE is high, eosinophils are high. Following statement is correct. So what is the diagnosis? So I told you a condition where immunoglobulin E are more and eosinophils are more. It's a case of ABPA. What I mean by ABPA? Allergic bronchopulmonary aspergillosis. So diagnosis will be ABPA. So ABPA, let us see the option. Most common causative agent is fungus. Yes, it is due to aspergillus. Aspergillus is having narrow septate hypha. True. Branching at 45. Absolutely true. Again, microbiology overlap with medicine. So you can see aspergillus is the fungus, and this fungus will have septate hypha. This is a correct statement. This is correct. X-ray shows patchy infiltrate. Yes, we call this fleeting opacity. So they sometimes ask you a radiology question, fleeting opacity, and CT scan is an investigation of choice. Absolutely true. In X-ray, you can see fleeting opacity, but this X-ray finding is non-specific. So to confirm this, what we need a CT scan. So this is also a correct statement. So itraconazole is drug of choice. Yes, we can use itraconazole. Alternative to this, we can use posaconazole, right? So itraconazole, posaconazole can be used. So this is also correct. So again, all three statements are correct. So correct answer for this question will be D. So remember in this question, so this is like a question which is telling you one topic. Actually, with this question, I want to teach you a topic. That topic is like ABPA patient. Who will develop ABPA? Remember, ABPA is more in patient generally with asthma, or in pediatrics. Sometimes it can be in a patient who's suffering from cystic fibrosis. So mostly patients are asthmatic, and for diagnosis you will see their IG value is more than 1000 international unit, and sometimes you will see eosinophil counts are higher. So this is a case of allergic bronchopulmonary aspergillosis. Okay, moving to next one. Middle-aged female came to medicine OPD with chief complaint of dry mouth, skin, xerostomia, xerodermia, gritty sensation in her eyes, dry eyes, xerophthalmia. So answer is clear. It is a case of Sjogren syndrome. So I hope nobody made a mistake here. So it's a case of Sjogren syndrome. In Sjogren syndrome, most sensitive antibody they are asking. They are not asking earliest. In Sjogren syndrome, what antibody we have? We have anti-Ro. Anti-La can also be used, but again, more sensitive is anti-Ro. Anti-nuclear antibody we can use to screen autoimmune condition, but here they are asking you here more sensitive is anti-Ro. Anti-CCP, anti-cyclic citrullinate peptide. It's an antibody that we have for rheumatoid arthritis. So answer for this will be anti-Ro. Sjogren syndrome. Anti-Ro is also called as anti-SSA. Anti-Ro is also called as anti-SSA. Just remember this anti-Ro or anti-SSA, Sjogren syndrome A. It is also present in neonatal SLE. It is also present in neonatal SLE. So it is also seen in neonatal SLE. Anti-La is something which we call anti-SSB, means Sjogren syndrome B. And this is ANA. ANA we do to screen many disease, but again it is more sensitive for SLE, not for other rheumatological condition. Moving to next one. 55-year-old man suffering from TB. Age. Present to medicine OPD with chief complaint of chest pain and breathlessness. He also complained of experiencing palpitation. So it may be heart failure. Let us see. And on examination, he had tachycardia with auscultation revealing pericardial knock. Pericardial knock or shudder. Pericardial or knock or shudder. So diagnosis for this case. Yes, very good. It's a case of constructive pericarditis. And remember, constructive pericarditis it can occur after tuberculosis. So patient is a case of constructive pericarditis. Now they are asking you all the following findings are indicative of diagnosis except. So in constructive pericarditis, can we see square root sign in diastolic waveform? Yes, it's a true statement. So sometime you will see this type of sign, square root sign in diastolic waveform. So this is a correct statement. So they are asking you except. Fall in systolic blood pressure more than 10 mmHg during inspiration. What it is? ये क्या है बताओ? इसको बोलते हैं pulsus paradoxus. Pulsus paradoxus is rarely seen. So अभी मैं इसको mark नहीं कर रहा हूँ. Just I am putting a dot here. In constructive pericarditis, you will see prominent Y descent. Yes. In cardiac tamponade आपको क्या दिखेगा? Prominent X descent. यहाँ पर prominent Y मिलेगा. Yes. Can you see ST elevation in ECG? In pericarditis, you can see ST elevation. Right. So that is why it is one of the differential diagnosis of MI. So देखो pulsus paradoxus is seen in very few patients. So mainly यहाँ पर आपको क्या दिखता है? You will see here small sign. So you can see pulsus paradoxus, but amongst these ST elevation you will see in many patients. Prominent Y descent in almost all patients. Square root sound, yes. So this is pulsus paradoxus. Remember this pulsus paradoxus, it is more classical for cardiac tamponade. So it is seen in a patient who developed cardiac tamponade. Is it clear? Not in constructive pericarditis. So because of this reason, answer for this question will be B. Okay, moving to next one. During medicine viva, student was asked about MEN2A syndrome. MEN2A syndrome, and student was asked about the feature out of following option which are not included in MEN2A. Okay, so understand is there what would have been chosen by the student if the examiner was satisfied with the answer. Okay, so understand we have men 2A. In men 2A syndrome, you will see, let me write all men syndrome. So you can see we have men 1, we have men 2A, we have men 2B. Men 1, men 2A, men 2B. So in men 1, you will see pituitary tumor, parathyroid hyperplasia, pancreatic tumor. 3P, pituitary, parathyroid, and pancreatic tumor. In men 2A, you will see parathyroid hyperplasia or tumor. Then you can see MTC. MTC means medullary thyroid carcinoma. And what else you can notice? You can notice like patient can also develop pheochromocytoma. So these are the feature of men 2A. So let us complete men 2B. Men 2B को और क्या बोलते हैं? Men 3. We also call this men 3. So in men 3 you will see patient can develop MTC. Patient can develop pheochromocytoma, means these two exact will be replicated here. Pheochromocytoma. Here also you can see megacolon. Patient can have mucosal neuroma. And if you see, patient will have marfanoid habitus. Marfanoid habitus. So now let us see the question. Do we see MTC? Yes. And remember, MTC is due to RET. RET is a proto-oncogene. Parathyroid hyperplasia or adenoma is seen. Yes. Pheochromocytoma, do we see? Yes. Megacolon we will see in men 2B. So answer, I think it will be megacolon. So answer is D. सिंपल है क्वेश्चन, इजी है. सो दिस इज अ क्वेश्चन रिलेटेड टू मेन सिंड्रोम. मेन मींस मल्टीपल. एक और होता है मेन 4. सो इन मेन 4 व्हाट वी हैव पिट्यूटरी, पैराथायरॉयड, एड्रिनल, रीनल, रिप्रोडक्टिव ग्लैंड ट्यूमर. पिट्यूटरी, पैराथायरॉयड, एड्रिनल, रीनल, रिप्रोडक्टिव ट्यूमर. So sometimes there will be tumor of testis, ovary. This will be in men 4. Okay, moving to next one. Let us see. A 30-year-old man comes to medicine OPD with complaint that his ring finger and hand do not fit him anymore. Ring finger, अंगूठी नहीं आ रही, टोपी नहीं आ रही. On inspection, the heel pad thickness is seen to be increased. So I hope you made the diagnosis. It's pure endocrinology. So diagnosis. So पहले मैं diagnose बना लूँ. It's the case of acromegaly. तो पेशेंट को क्या है? एक्रोमेगेली. सो एक्रोमेगेली के लिए पहला टेस्ट हम क्या करते हैं? IGF-1 लेवल. सो फर्स्ट टेस्ट विल बी IGF-1 लेवल. तो उसके बाद क्या करोगे? OGTT. सो लेट अस सी फर्स्ट ऑप्शन, ओरल ग्लूकोज टॉलरेंस टेस्ट विद ग्रोथ हार्मोन लेवल इज यूज्ड टू कंफर्म द डायग्नोसिस. एब्सोल्युटली ट्रू. इनकरेक्ट पूछा ना? इनकरेक्ट. सो OGTT वी डू टू कंफर्म. मोस्ट कॉमन कॉज ऑफ डिसीज इज ग्रोथ हार्मोन सीक्रेटिंग पिट्यूटरी एडिनोमा. सही बात है ये भी. Acromegaly, most common cause is growth hormone secreting adenoma. IGF-1 level are used for screening. Again, it's a correct statement. और अगर आपको ट्यूमर को देखना है, if you want to see the tumor, in that case what we need, अगर आपको ट्यूमर देखना है, for this you need MRI, a brain MRI. Last option क्या बच गया? Cause of death in these patient is renal failure. No, cause of death is heart failure. सो इनकरेक्ट पूछा है. सो याद रखना, कॉज ऑफ डेथ इज हार्ट डिसीज, नॉट रीनल डिसीज. सो आंसर विल बी डी. इजी वन. ये तो इजी था. चलो अगले क्वेश्चन पर चलते हैं. मूविंग टू नेक्स्ट वन. सो नेक्स्ट क्वेश्चन व्हाट यू कैन सी अगेन, आप अगर ध्यान से देखोगे सो दिस इज आल्सो इजी वन. SIDH का क्वेश्चन है. 73-year-old मेल, एज इज द हिंट, who recently suffered from stroke. स्ट्रोक आया हुआ है. फिर नॉशिया, वॉमिटिंग, कंफ्यूजन हो गया. Blood sample are sent for investigation of patient diagnosed with suffering from SIADH. Following finding is not seen in this patient. तो देखो इसको समझो. So SIADH means patient here will develop euvolemic hyponatremia. Euvolemic hyponatremia होता है. So it is not the answer. So understand this. There is more ADH. Because of more ADH, patient का यूरिन कैसा आएगा? एंटी डायूरेसिस. ADH will cause urinary retention. So patient को यूरिन कम आएगा. So there is more ADH means opposite to diuresis means there is scanty urine, कम urine आएगा. So whenever there is scanty urine, in this case you will see like whatever urine is coming, that will be scanty or concentrated. So if you see in the scanty urine, osmolality of urine, so urine osmolality and urinary sodium. So urine osmolality or urine sodium, these two things will increase. Now entire water is there is water retention. So plasma osmolality and plasma sodium, these two things will be lesser. Now let us see, urine osmolality बढ़ेगी, correct. Increase urine and decrease plasma sodium, urine में sodium बढ़ेगा, plasma कम होगा, yes. Plasma osmolality बढ़ेगी, no. Plasma osmolality is reduced. You can clearly see plasma osmolality is, so answer will be A. So again, diagnosis for this case will be SIADH, so plasma osmolality will decrease. Okay, coming to next one. Given below are types of vasculitis and performed investigation for diagnosis. Identify the incorrect among the following. In Kawasaki disease, we have anti-endothelial antibody. Incorrect ढूंढना है आपको, ये तो सही बात है. So so that's why you will see endothelial injury and ultimately patient can develop aneurysm. There is risk of MI. Giant cell arteritis means इसमें आप temporal artery biopsy करोगे, yes. और मैं अगर इसको थोड़ा add करूँ, so you will take biopsy of a longer segment, 3 to 5 centimeter biopsy करने, because patient will have skip deletion. Correct है. Microscopic polyangiitis में C अंक का होगा नहीं, C अंक का तो वैगनर्स में होता. So C अंक का आज से अभी से वैगनर को हम वैकेनर लिखेंगे, वैकेनर. So वैकेनर means C अंक का. Microscopic polyangiitis will have P अंक का. तो याद रखो P अंक का will be seen in Churg-Strauss syndrome and microscopic polyangiitis. So this is a wrong statement. They are asking incorrect. So this is the answer. टाकायासु में क्या करोगे आप, आर्टेरियोग्राफी और सीटी एंजियोग्राफी. अगेन टाकायासु के लिए आपको एंजियोग्राफी करनी पड़ेगी. सो अगेन दिस इज आल्सो करेक्ट स्टेटमेंट. सो माइक्रोस्कोपिक एंजाइटिस, माइक्रोस्कोप polyangiitis, what antibody we need? We need P अंक. Okay, moving to next one. 29-year-old male with severe yellowish discoloration of the skin, abdominal pain and vomiting was admitted to medicine department where further workup revealed hepatitis B infection. So again this is कितनी बार मैंने आपको बताया. So again simple thing, HBs antigen positive means it is entry of virus, entry हो गई. HBe antigen is positive, it means virus is now dividing, replicating. Replicating means it is now turning to be infective. So now I can say it is infective. And anti-HBC IgM is positive. If IgM is positive, it is acute. So I am not seeing the option. Now देखो बाकी negative है, negative है. मैं option नहीं देख रहा हूँ. I made a diagnosis because in practice you will not have any option. So it's the case of acute infective hepatitis B. कहीं पर है acute infective hepatitis B. This is the answer. Simple. तो आंसर क्या होगा? Acute infective hepatitis B. Okay, moving to next one. अगले पे देखते हैं क्या है. A middle-aged man presented to medicine OPD with diarrhea, weight loss and blood in stool. अब देखो, whenever you think about blood in stool, so it could be many things. Weight loss आ रहा है तो कैंसर भी हो सकता है. आगे पढ़ते हैं. Physician decided to do an endoscopy which revealed cobblestone appearance. So मेरे को आंसर मिल गया. So this is a case of Crohn's disease. Crohn's disease can also have blood in stool. It can also have weight loss. It can have diarrhea. Following is incorrect about the disease of man is suffering from. Crohn's disease is mainly due to डिफेक्टिव इनेट इम्यूनिटी और ओवरएक्टिव एक्वायर्ड इम्यूनिटी. अगर आप देखोगे लाइक हमारी ऐप में हमने जो पहले इन्फ्लेमेटरी बाउल डिसीज का जो स्टार्टिंग करी तब मैंने आपको ये लाइन बताई, दिस इज फ्रॉम हरिसन. इट्स ड्यू टू डिफेक्ट ऑफ बोथ इनेट एज वेल एज एक्वायर्ड. तो इट्स अ करेक्ट स्टेटमेंट, ये करेक्ट है. क्रोन डिसीज में नॉन किस्टिन ग्रैनुलोमा मिलते हैं. ट्रांसमिट इन्फ्लेमेशन और कैरेक्टरिस्टिक फीचर, यस. इन क्रोन डिसीज यू विल सी नॉन किस्टिन ग्रैनुलोमा. हाउएवर दिस ग्रैनुलोमास आर एब्सेंट इन अल्सरेटिव कोलाइटिस. क्रोन्स में ये मिलेंगे. ट्रांसमिरल होती है, यस. अल्सरेटिव कोलाइटिस इज लिमिटेड टू म्यूकोसा एंड सबम्यूकोसा. कंटिन्यूअस लीजन क्रोन्स में कहाँ होते हैं? कंटिन्यूअस, राइट. क्रोन्स में तो स्किप्ड होते हैं. सो दिस इज द आंसर. एंटीबॉडी अस्का होती है, यस. अस्का इज एंटी सैक्रोमाइसिस सर्विसी एंटीबॉडी. राइट. सो आस्का भी मिलती है. सो आंसर फॉर दिस क्वेश्चन विल बी सी. Okay, moving to next one. I think this is our last question. So let us see. Patient diagnosed with multiple myeloma in ICU setting is found to have RTA type 2. Like we have three main type of renal tubular acidosis. In type 1 and type 2 you will see hypokalemia. In type 3 न्यू टर्म अभी आ गया, लेकिन पहले नहीं होता था, एक कॉमन नहीं है, अभी टेक्स्ट बुक में नहीं आया. सो वी हैव टाइप 1, टाइप 2 एंड टाइप 4. टाइप 4 इज आल्सो कॉल्ड एज हाइपरकैलेमिक टाइप. सो दे आर आस्किंग यू टाइप 2. Following statement is correct with respect to RTA type 2. So कोई भी RTA हो, देखो इसको याद रखो, whatever is the type of RTA, so I can say it can be RTA type 1, type 2 or type 4. In every type of RTA you will see NAGMA. NAGMA means normal anion gap metabolic acidosis. So RTA का फीचर होता है, वहां पे क्या होता है, नॉर्मल. So ये तो रॉन्ग स्टेटमेंट है. Now moving to option B, acidification of urine is hampered because there is impaired H positive excretion. Understand, urine acidification is hampered, so this is basically a case of RTA1. RTA2 पूछा है आपसे, तो ये भी एक wrong statement है. There is a defect in PCT part of the nephron, so ये ठीक है, it's correct statement. And nephrocalcinosis is common in RTA type 2. Now understand, nephrocalcinosis आपको जो मिलेगी वो type 1 और 4 में मिलती है, type 2 में नहीं मिलती है, इसका फीचर होता है. So nephrocalcinosis is not seen in type 2. So answer will be C. Okay, so this is the last question. A 38-year-old female comes to medicine OPD with chief complaint of fatigue and generalized weakness. So examination, she has pallor, anemia है, serum iron and TIBC are low. Serum ferritin is increased. Peripheral blood film shows the finding given in the image below. What is the probable diagnosis? Okay, so understand this. You can see like a different finding in peripheral blood film. So इसको कैसे solve करेंगे? You can see serum iron is low, right? Serum iron is low. Ferritin. Serum ferritin is stored form. Stored form is more. All the iron is trapped in the store. और I told you ferritin is inversely proportional to TIBC. So TIBC कैसा आएगा? कम आएगा. TIBC कम भी दिया है, right? So when you see, अगर iron deficiency होता तो सबसे पहले क्या कम होता? ferritin. But ferritin यहाँ बढ़ा हुआ है. So it is not iron deficiency, right? In megaloblastic anemia, we'll not talk about ferritin or anything. In sideroblastic anemia, you can see it is serum iron will also be more. It is iron overloaded state. So again, you can see this is a case of anemia of chronic disease. Why? Because entire iron is trapped within store and ferritin is reflection of the store. तो ये आपको समझना है. So this is a case of AOCD, anemia of chronic disease. So I hope you enjoyed the discussion. With this, we'll conclude. Thank you so much. Keep working hard. Bye-bye.
Now we start psychiatry. First question, a 28-year-old man admitted to hospital diagnosed with carcinoma lung. As a first-year resident in psychiatry, you consider Kubler-Ross, Elizabeth Kubler-Ross model. As you start to comprehend his feeling and emotion, which of the following accurately describe the grieving process he might go through? Before answer, you must know stages of death or dying given by Elizabeth Kubler-Ross. If a person comes to know that he is about to die, he is having terminal illness, just like lung cancer, he will go through these phases. And the mnemonic for this is DABDA. D-A-B-D-A. D for denial. First of all, patient would deny, no, how can I have cancer? I have never smoked, I have never taken alcohol, how can I have cancer? Means denial. Then anger. Anger towards God. Hey God, why me? Question has been asked. This is anger, not agitation. Not agitation. Marpeet nahi hai. Yes, not agitation. This question was asked. After that, he will bargain. Hey God, this time save me. I will never smoke. I will not do this. I will not do that. That is bargaining, just like Three Idiot. Malti ko apni behan samjhunga. Okay. Then he will go in depression. Suppose report came that now you are left with only 2 months, then he will go in depression. After some time, he will accept, okay, I am left with only 1 month. So let's do something productive. Enjoy karna chahiye, should enjoy with my family. So these are stages of death and dying. But we want that if a person is diagnosed with terminal illness, patient should directly enter to acceptance. So how to break bad news? There is a fixed pattern. If we break bad news in this pattern, there are chances that patient may enter acceptance as early as possible. Chances are there. And what is this? Spikes pattern question has been asked. What is spikes? S for setting, P for perception, invitation, knowledge, empathy, expectation, summary. So in this question, DABDA, denial, anger, bargaining, depression, and acceptance. These are the stages of death and dying. Next question. 29-year-old lady seeks treatment for repetitive hand washing, obsessive worries, OCD. Yes, about contamination. Most common obsession is contamination. Question is asked. She is upset since these rituals interfere with her normal activities. The doctor links her symptom to a dysfunction of brain area. Which area of brain is unable to control goal-directed behavior in OCD? So in OCD, 2-3 questions are asked on etiology. First is cortico-stratothalamo-cortical tract or circuit. There is dysfunction at cortico-stratothalamo-cortical tract. Decreased serotonin. At few places it is written serotonin dysfunction. Okay. There is bilateral caudate nucleus atrophy. Caudate nucleus atrophy. So caudate nucleus is involved in OCD. So answer is caudate nucleus. Treatment question is asked in OCD. Best treatment is exposure and response prevention, CBT. So if both are given, better answer is exposure and response prevention. Next question. 10-year-old child is brought by his parents to the pediatric clinic. They claim that he frequently forgets to finish his homework, frequently struggle to stay seated during family meals. Means he is not sitting at one place. Means hyperactivity is there. Frequently disturb conversation. Okay, impulsivity may be there. According to his school record, he frequently divert the attention of his peers and struggles with concentration. Means inattention, ADHD. Attention deficit means attention is not there, concentration is not there. Hyperactivity is there. He is not sitting at one place. Diagnosis is ADHD and the drug of choice is methylphenidate, stimulant drug. Stimulant. So in ADHD, pharmacotherapy stimulant, methylphenidate, dexmethylphenidate, amphetamine, modafinil. These are stimulant and this is drug of choice. Non-stimulant drugs are atomoxetine, bupropion, clonidine, guanfacine, venlafaxine. In this, drug of choice is atomoxetine. So if question is asked, non-stimulant drug of choice is atomoxetine. So in this question, they have given 10 years. Previously, we used to say to diagnose ADHD, the age should be 7 years. Now it is 12 years. Okay. Now, in this question, if I add that the patient has history of seizure, if history of seizure is there, you can't give stimulant, then drug of choice would become atomoxetine. Point it out. A question was asked that This patient has family history of substance abuse or substance use disorder, alcohol use disorder. In question, it was given that father is having alcohol history. So if history of substance use is there, we will avoid stimulant because stimulants are addictive. So substance history in family, history of substance, then again the answer would become atomoxetine. Yes, schizophrenia, positive symptom, negative symptom. Question, a 28-year-old exhibited social disengagement, sloppy hygiene, emotional flatness for over a year. Yes, this is the old classification ICD-10 to make the diagnosis of simple schizophrenia. Duration of negative symptom should be 1 year. Although it is not used, this classification is old, but even now question can be asked. So simple schizophrenia, negative symptoms should be present for how much duration? 1 year. Remember, as a result of these adjustments, he was fired from his employment and was diagnosed with negative symptoms of schizophrenia. This result due to involvement of. So positive symptoms of schizophrenia are delusion, hallucination. These are due to increased dopamine at mesolimbic pathway. At which pathway? Mesolimbic pathway. Limbic matlab lamba. Increased dopamine. Okay. Negative symptoms just like alogia. Logia means language, decreased verbal communication, anhedonia, not getting pleasure in previously pleasurable activity. Question has been asked. Suppose you used to enjoy playing cricket. Now you don't enjoy playing cricket. Anhedonia. Previously you used to talk to your girlfriend, enjoy, but now you don't. This is anhedonia. Maybe. But the other chance is girlfriend or boyfriends are पुराने हैं, old हैं, बहुत लंबा time हो गया है. So in psychiatry we usually consider that we should take detailed history for the time being. Yes, you know, anhedonia, not getting pleasure in previously pleasurable activity. Asociality, no social interaction. Apathy, lack of concern. You have concern for your exam, for your future, but they don't have. Avolition, meaningful activity is not there. A motivation, there is no motive in the life. These are negative symptoms of schizophrenia. This is due to decreased dopamine at mesocortical pathway. In Hindi, C for cortical, C for cum. Cum dopamine. Cum dopamine, negative symptom. Jada dopamine, increased dopamine, positive symptoms. So in this question, they ask that negative symptoms are due to involvement of mesocortical pathway. Yes. 28-year-old female presented in psychiatry OPD with repeated history of pulling hair leading to patch of baldness on her head as shown in the image. On further examination, she has hair growing of different length on her scalp. Patient is diagnosed with trichotillomania. Yes, many times you will find long clinical question, but in the last you will find they have directly given the diagnosis. I have taken 2-3 questions like that. Okay. So trichotillomania is there. According to DSM-5, trichotillomania is now OCRD, obsessive compulsive and related disorder. Question, trichotillomania previously was impulse control disorder. Impulse control disorder. But now trichotillomania is obsessive compulsive and related disorder. Yes, this is list of ICD-11 of OCRD, not DSM-5. Okay, I will point out what are included in DSM-5. For the time being, ICD-11, hoarding disorder, hypochondriasis. Question has been asked. Hypochondriasis is now OCRD. Important. OCD, part of OCRD. Olfactory reference syndrome, ICD-11. This entity has been included. Body dysmorphic disorder, OCRD. Body focus repetitive behavior disorder, ICD-11 included these 2 entities in body focus repetitive behavior disorder. If I ask you about DSM-5 and tell you about DSM-5, then yes, DSM-5, this is OCRD, this is OCRD, this is OCRD, this is OCRD, this is OCRD. Okay, hoarding, OCD, body dysmorphic disorder, excoriation, trichotillomania according to DSM-5. I know this is little bit confusing, but recently 2 times in INI-CET they have asked question that trichotillomania is now OCRD. Hypochondriasis is also OCRD. Thank you. Best wishes.
So hi everyone, I hope you enjoyed this CBoT. So when we talk about the surgery, what was the overall view of the students? I have got to know that yes, it was a combination of mix and so it was tough also, it was easy also. But let me tell you, the paper was very conceptual. Now, if you let us start with the, you can say, paper. A 38-year-old gymnastic try to understand a gymnastic if related with a question. Let us correlate it later. Brought to emergency department when he suffered an injury during the practice session. So a gymnast, when he suffers an injury, the injury is mostly concentrated to the what students? To the perineum. Now let us see. So there is a direct blow to the perineum. Remember the catch, direct blow. Injured is perineal area, unable to urinate with urological examination showing blood at meters. So blow to the perineum. Loss of micturition or anuria with blood at the meatus. What is it? It's a urethral injury. It's a urethral injury, and most probably it is anterior urethral injury, but let us confirm it with a retrograde ureterogram. So a retrograde ureterogram shows. So now you can see this is how we determine the, you can say, levator ani. So this is naturally the boundary of the levator ani. So this is posterior because this is pelvis. So posterior urethra, anterior urethra, this is penile urethra, and this one is the bulbar urethra. So which of the following is the site of injury? Let us read the options. Urinary bladder, prostatic urethra, bulbar urethra, membranous urethra, all of them can be injured with the injury. But here, as the retrograde ureterogram shows you a typical drain, or you can say extravasation of the contrast in the bulbar region, this is bulbar urethral injury. Let us go to the next question. 69-year-old male being intentionally stabbed by his brother, due to which he suffered upper abdominal injury. Let us leave the line dispute over the property, blah blah blah. On admission, the pulse was 42, so bradycardia right now, and BP was 80/60. So hypotension. So there's acute hypovolemic shock because of the blood loss. The doctor ordered the chest X-ray, which was absolutely normal. So there is nothing like pneumothorax or hemothorax. But what it could be, the very important thing is, it could be a injury to the heart. That is, it could be a cardiac tamponade, or it may be a vascular injury to the abdomen, which might be requiring an you can say exploration. So what is the, since this is a penetrating injury, this is a penetrating injury, ideally we should be going for a surgery, but right now we need to check for the cardiac tamponade. In order to rule out cardiac tamponade, we will also go for fast or e-fast. This is what is very important. So remember, ideally this question is wrong. First of all, a patient who is so hypertensive, we don't waste a lot of time, but the chest X-ray can be done bedside. We cannot take that patient for CT scan, or DPL right now is not an option for him. So this patient has been stabbed above, chest X-ray is normal, hypotension is there, the patient is having the critical profile of the organ injury with hypovolemic shock. One very important thing that we need to rule out before proceeding for laparotomy is cardiac tamponade. So I would have marked option D is better than option B. This is what is simple. So sometimes you have to understand the logic behind the things. A 48-year-old patient presents to the casualty with severe flank pain and a palpable flank mass. So flank pain and flank mass. So flank pain, flank mass, this is suggestive of what, students? Renal tumor. Now this patient, she was having hypotension, and CT scan shows the findings below. So why there is hypotension? Can you see there is hematoma? Spontaneous retroperitoneal hematoma. It could be seen with RCC also, but RCC, you will never get a hyperintense image because of the fat present in this. So the only renal tumor which can be confidently defined on CT, a fat rich tumor or fat rich renal tumor, is angiomyolipoma. This is what is very important. So angiomyolipoma, this is there, and this thing, that is a tendency of spontaneous rupture. This is what is known as a Wunderlich syndrome. So let us see. So with respect to that, which of the following is incorrect? So angiomyolipoma, it's a tumor of PCOMA category. What is PCOMA? Perivascular epithelioid cells. So remember, this is absolutely true, and they also stain marker that is common for the soft tissue sarcomas, that is HMB, human melanocyte black 45. So this is true. The patient can go into hypovolemic shock, and this is Wunderlich syndrome. So this is also true. Tumor is typically showing the spoke wheel arrangement. No, spoke wheel arrangement is seen in the classical benign tumor. Angiomyolipoma is not showing you this. So very important thing is that oncocytoma shows you a spoke wheel arrangement, but angiomyolipoma is not. So angiomyolipoma is totally different. Why? Because it's a fat rich tumor. So this is false. Yes, usually they don't require treatment, but a tumor more than 4 centimeter might require you can say angioembolization, followed by, if not happening, working, then we go for partial nephrectomy. So option C is also true, but option D is incorrect. Let us go to the next question. 38-year-old male was brought to ER with second degree burn involving the anterior part of the chest and the abdomen. So 9 plus 9, that is equal to what, students? 18%. Anterior aspect and the posterior aspect of both the limbs. So one limb is 18. So 18 into 2, 36. 36 plus 18, that is 54%. It's a straightforward question for you. So answer is 54%. Next is, a 55-year-old male presents with complaint of increased drainage from the pancreatico-jejunostomy side. So PJ is done for trauma patients. PJ is done for the pancreatic tumor patients. So what is the reason? Let us see. On post-operative day 3, any drain from the PJ side, pancreatico-jejunostomy side, on day 3, and if it is found to be rich in amylase, it confirms that it's a pancreatic leak or a fistula. So this is what is known as anastomotic leak. I'll not even read the question. He has undergone a Whipple's for a pancreatic cancer. It's a very simple, straightforward question. Let us go to the next question. 42-year-old man brought to casualty with RTA. Due to multiple injuries sustained, there was an improportionate amount of blood loss which was found to grade into class 3. So they have made a diagnosis that it's a class 3 hypovolemic shock. Now, which of the following is a characteristic? So when we talk about hypovolemic shock, blood loss should be more than 30%. So this is wrong, because blood loss is 15 to 30% given in this case. The second is patient systolic blood pressure is decreased, but mean arterial pressure is normal. Absolutely wrong, because in grade 2 onwards, the MAP starts to decrease. So this is wrong. Heart rate is more than 120. This is absolutely right, and urine output is decreased below 15 ml. So this point is absolutely true. So respiratory rate more than 20. Again, we have heart rate more than 120 and decreased urine output. They are cardinal features. Let us go to the next question. 39-year-old female presents with lump in the left breast. The examining surgeon found a 6 centimeter palpable mass in the right lower quadrant of the left breast. So there is, let us see something like this. Okay, let us understand that investigations where a biopsy is suggestive of invasive ductal cancer with no lymph node. Radiological investigations reveals no metastasis. So this is a 6 centimeter lump, more than 5 centimeter. This is considered as large inoperable CA breast. Why? Because when you take the skin flaps, it is what is very difficult. So first we'll go for the NECT. So NECT has to be done, because students, neither you can go for BCS in this case, nor you can go for MRM, because the size of the tumor is big. So this is T3, N0, M0. So NECT followed by surgery. Now this is your choice. You can go for BCS or you can go for MRM. This is what is the answer. So option D is the best answer available here. Next is, what are you seeing? This is a Melanese gangrene or a synergistic gangrene or a Fournier's gangrene. So let us see Fournier's gangrene and let us answer the questions. Which of the following is incorrect? No need to see the question. This is what is the advantage when you have an image. Next is, it is usually a vascular, it may be a sepsis, blood-borne sepsis causing this. So this is absolutely true. The infection may proceed to the anterior abdominal wall because of the same vascular drainage. So absolutely true. It requires immediate bilateral orchidectomy. Remember, the testicular blood supply is saved and it's separate. So this is not. Do you know what we do? We do a debridement with shameful exposure of the testis. What is that? We debride everything, just expose the testis. This is what is the management. But we don't do orchidectomy. So option C is incorrect for this now. Next is, let us go to the next question. Chronic alcoholic diagnosed with chronic pancreatitis now presents to surgery PD with complaint of weight loss with no pain and severe discoloration. So progressive obstructive jaundice with you can say weight loss without pain. So now this is more in favor of what students going for malignancy, which describes as slowly evolving within the last few months. On examination, right palpable mass is also seen. Which of the following? Students, it's not necessary that it is now going into malignancy only. There could be progressive worsening and compression of the CBD. That can also. But let us see. Since the information given us is like this, we will see the options. Ideal option will be Whipple's. Ideal. This is what? Remember, this is also right, this is also right, this is also right. But A is better option than B, D and C. This is what is the answer. Remember, solving MCQ is art. You need to segregate. So the history is more of malignancy. So I would be going for pancreatic or duodenectomy. It may be pylorus preserving or a classical type, whatever you say. Remember, 54-year-old patient presents to ER with sudden tearing type of chest pain radiating to interscapular region. So this is now more in favor of aortic dissection. The patient was ordered a chest X-ray by the physician with showing of the following things. Which of the following is incorrect? So this is a classical aortic dissection. You can see the widening of the aortic shadow, aortic silhouette. So let us read the question. Which of the following is incorrect? Hypertension and increased age are common association. You can say true. Investigation of choice for a stable patient is transesophageal. Absolutely wrong. It is CCT. If it fails, then go for CT angio. DeBakey system is commonly used for classification of the pathology. You know, DeBakey A, B, C. So, DeBakey 1 is both the ascending and the descending. DeBakey 2 is only ascending and DeBakey 3 is descending. So this is what is very simple. So option B is absolutely incorrect because transesophageal echo is done for the unstable, not for the stable patients. A 45-year-old patient coming to surgery OPD with enlarged thyroid swelling. Physician on probing the history suggests that it is suspicious of malignancy. So FNAC was ordered, but FNAC report comes out to be non-neoplastic. Which of the following will correspond to this report? So FNAC was ordered and FNAC revealed it to be non-neoplastic. What is that? So remember THY. When we talk about the FNAC grading system, this is pathology question. So if it is 1, this is non-diagnostic. Non-diagnostic. If it is 1C, that is non-diagnostic but cystic. Then we have THY2. This is non-neoplastic. Non-neoplastic. When we talk about THY3, it is follicular. It is follicular. TH5 is suspicious and TH6 is malignant. Remember, TH2 is the answer here. Why? Because it is non-neoplastic. It's a very easy, straightforward question. Next is, what are you seeing here? You are seeing the classical water lily sign. And remember, water lily sign is due to detached laminar membranes from the cyst wall. So this is what is a classical C3A. Why? Because C3B, there is consolidation. You know, when you talk about CE1, that is hydrated sand. This is hydrated sand. CE2, you have a different appearance. CE3, you have different. CE4, every stage is very, 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 very important. So let us try to understand. Hydrated sand is seen in CE1, CE2 we get to see honeycombing, CE3 we see 3A as the classical water lily, and CE4 we get to see the woolen ball or a woolen sign. This is what is very important. So woolen ball or a ball of wool sign. Forget everything. I'm not going to read. Let us see the light. Which of the following is incorrect? Investigation of choice for the above is CT. This is true. Above USG finding corresponds to stage 3A, not 3B. The first line treatment would be pair, but it is an intervention. Therefore, this is not always the treatment. The treatment of choice is always a pericystectomy. Remember, FNAC is usually contraindicated. This is absolutely true because of the risk of rupture and spreading of this. So option B is incorrect in this. This is what is important. CE3A is important when we talk about this laminar separation giving you a water lily sign. Let us go to the next question. During surgical viva, external examination gives the following traits in the condition. Which of the following would be chosen by the student as incorrect? When we talk about Meckl's triad, it's seen in Bohaf syndrome, you know, epigastric discomfort, subcutaneous emphysema and vomiting. Rigler's triad in gallstone ileus, that is ectopic gallstone, intestinal obstruction, pneumobilia. Whipple's triad, that is onset of hypoglycemia. blood sugar less than 45, and rapid correction of symptoms on external administration of glucose. So this is also tried. Burkhardt triad is not seen in sigmoid volvulus. It is classically seen in gastric volvulus. So gastric volvulus, we have epigastric pain, little or no vomiters with intense retching and inability to pass the Ryle's tube. This is what is Burkhardt triad. So option D is incorrectly matched here. Let us go to the next question. A patient came as a jeep driver with pain and purulent discharge. So prolonged sitting, this is going to result in what? A classical needle sinus. Let us see what the question has to give us. The examiner explains that the most definite treatment would be to go for an excision and flap surgery. Which of the following flap is done? So you create a rhomboid defect. So you need to bring the nearby skin over this and close this defect. So this is what is a classical Limburg flap or a rhomboid flap. This is what carapenthic flap is for lip reconstruction. This is for the radial forearm flap is for the tongue reconstruction. Deep inferior diaphragm is used for the breast reconstruction. So again, if you knew about the others also, you would have been able to answer it. Next is a female patient presents to surgery OPD with complaint of dysphagia more to liquids and solid. Just see, can you see the bird beak appearance? Bird beak appearance here. So now you have the scene that it is a case of eclasia. Let us see. There is progressive loss of mentric and mentric plexus in the condition. So what are they asking? Which is false. Okay, so this is absolutely true. In esophageal motility disorder, the investigation of choice is not 24-hour pH monitoring. It is the manometry, because you need to check the pressure and the amplitude of the contraction. Surgery is the definite management. Absolutely right, because this is progressing condition. And the option that is incorrect is B. B is absolutely incorrect in this. Next is, which of the following statement about the sutures and their uses are correct? Sutures. Catgut is non-absorbable suture. Absolutely false. It is an absorbable suture. And it is not from the cat, it is from the sheep's mucosa. Silk is a natural non-absorbable and can be used for fixing drain. Absolutely true. Monocryl is synthetic, absorbable, delayed absorbable and used for subcutaneous suturing. Nylon is synthetic, non-absorption, used in vascular repair. This is false, because nylon is used for ligament and tendon repair. So this is again a very straightforward question. So this was about the CBT that you gave, and I hope you enjoyed this test. Till then, bye-bye.
Hello, my dear friends. A very warm welcome to all of you in this CBoT discussion session. And I'm not going to take question number 1 first, but I'm going to start with this question on dehydration of a child, how to assess it, how to treat it. And we will also discuss how to classify, assess and treat pneumonia cases. Although it is pediatric topic, but of course PSM and pediatric both deal with it. And it is very frequently asked area of question. So they are saying that there is a 4-year-old child who passed 8 stools in last 24 hours. The child drinks eagerly. And if the child is not drinking eagerly, let's say the child is not responsive, that's a danger sign. And the child will directly go into severe dehydration like thing. It can indicate severe dehydration. But he is drinking eagerly, then skin pinch goes back slowly. So when you will read the classification, if the skin pinch go back very slowly means more than 2 seconds. And now we pinch abdominal skin and we let it go back. If it go back within 2 seconds, it is slowly. If it take more than 2 seconds to go, it is very slowly, and very slowly indicates severe dehydration. So that means it is not a case of severe dehydration. Now, we should look at the classification part, which is given in the Park textbook, and that will help us to understand it better. So if you can see here very clearly that we call it severe dehydration and we classify it in pink if infant have movement only when stimulated or no movement at all. And as I was saying, sunken eyes and skin pinch go back very slowly. So very slowly, sunken eye and no movement, non-responsive child, then it is severe dehydration, pink category. Yellow category is for some dehydration for which 2 of the following sign is needed. First, restless and irritable. Second, sunken eyes. Third, skin pinch go back slowly. So it was written there that a skin pinch go back slowly there. So this one thing is being fulfilled there. And the child was drinking eagerly. So this is indicating some dehydration. Okay. And in this case, this we have to refer the child urgently to hospital with mother, and we have to keep giving ORS to the child. But if there is no severe sign, then the child is classified in green category, and of course we can manage it at home. Now, how we manage the cases? First of all, they ask the dose of zinc sometime in exam. So remember, it is written here that from 2 months to 6 months, we only give half tablet of zinc daily for 14 days. So 10 milligram of zinc is given from 2 months to 6 months only. Previously, it was 2 months to 1 year. Now, it is 2 months to 6 months, 10 milligram. And 20 milligram for all the children more than 6 months. And this is given for, of course, 14 day. Why? Because I hope you all know zinc help in maintaining the cilia, the cilia of columnar epithelium, which is there in the gastric mucosal area. That is being built by zinc. And when the cilia is built, then the absorption area increases and intestine start functioning normally. And there is one more question which came from this part in NEET just this year, that if patient have dryness around mouth and nose area, that also represent zinc deficiency, and the disease from it is acrodermatitis enteropathica. So that is one point. Second point, in all these children, they have written that if it is plan A means some dehydration, child can be treated at home. In this case, we have to give ORS up to 2 years, 50 to 100 ml after each loose stool, and after 2 years, 100 to 200 ml after each loose stool. So this is how we treat: 50 to 100 for less than 2, 100 to 200 for more than 2. Now, if the child is in plan B with sunken eyes or skin pinch go back slowly or irritable child, in that case, we treat the child according to weight. Up to 6 kg, we give 200 to 450 ml of ORS. 6 to 10, we give 450 to 800 ml of ORS. 10 to 12, 800 to 960 ml of ORS, and 12 to 19, 960 to 1600 ml of ORS. But mostly they do not ask question from plan A or plan B. Mostly they ask question from plan C. Because remember, plan C is for severe dehydration with non-responding child, sunken eyes, and skin pinch goes back very slowly, more than 2 seconds. In that case, if the age is less than 12 months, if the child is infant, less than 1 year, then we give 30 ml per kg in 1 hour and then 70 ml per kg in 5 hours. So total 6 hours, we give 100 ml per kg. And in this 100 ml per kg, first hour 30 ml per kg we give with speed, and then slowly we give 70 ml per kg in next 5 hours. But if the child is between 1 year to 5 years, then we give this same amount of fluid, 100 ml per kg, in half the time. Here we are taking 6 hours, there we will take only 3 hours. In the first half an hour, we give 30 ml per kg, and then 2.5 hours we give 70 ml per kg. So do remember that the total amount we give in plan C is 100 ml per kg, and 100 ml is divided 30 and 70. If the age is more than 1 year, it is half an hour and 2.5 hours. If the age is less than 1 year, then it is 1 hour and 5 hour duration in which we have to give 100 ml per kg. Now, this is for management of diarrhea. Remember, pink, yellow, then green. Similarly, this pink, yellow, green also apply for pneumonia cases. If there is any general danger sign, what are the danger sign? If it is their child is having convulsion, child is having cyanosis, child is having high grade fever, child is not responding to any stimulus, then he or she is classified as severe pneumonia. Plus, there is one more thing, stridor in calm child. Stridor means gur, gur, this type of sound comes out while breathing. That is stridor. So if you found that you have to urgently refer the child under pink category, and then in the hospital, the 2 antibiotic which is given for this category is benzyl penicillin and gentamicin, because a lot of children are allergic to penicillin and it can lead to anaphylactic reaction. So we can give gentamicin injection. So in pink color, directly refer severe pneumonia. Now there is nothing like mild, moderate pneumonia. Severe pneumonia, then cough or cold. In case of pneumonia, there will be chest indrawing and fast breathing. Chest indrawing is appreciated here at the costal margin, below the costal margin, and fast breathing. For fast breathing, if the age is less than 2 months, more than 60 per minute respiratory rate is fast breathing. If the age is 2 months to 1 year, then more than 50 is per minute is fast breathing. And if the age is more than 1 year, in that case, more than 40 per minute is fast breathing. So 60, 50, 40, 2 months to 1 year, and more than 1 year. If you found fast breathing, chest indrawing, then in that case, we will give amoxicillin syrup for 5 days. And if you find none of these things, then the child is only having cough or cold, category is green, and child can be managed at home. So do remember this diarrhea and pneumonia management which we give in these cases. Okay, this is very important. So now let's go back to our first question and start the discussion from there. Okay. So welcome, and let's go to our question. This was the question that which of the following don't have subclinical case. So what do you mean by subclinical case? Subclinical are those cases which recover without symptom. Which recover without symptom. Let's say I have been bitten by, suppose, a rabid dog. Today afternoon I was coming and a rabid dog came and bite on my bum, this big. And I did not took rabies vaccine. So after 3 months, 4 months, 1 year, after some time, I will also start barking now. I cannot hide the symptom of rabies. I will develop it sometime. So in rabies, no case recover without symptom. Everyone will develop symptom at some time. Similarly, in case of tetanus, if I develop tetanus, I will develop symptoms after some time. If I develop measles, I will develop symptom after some time. I cannot recover without symptom in these 3 illnesses. But in case of polio, there are a lot of subclinical cases. If one case of polio is reported from a village, it means 999 children were also infected in that area, but these 999, they recover without having this clinical symptoms of flaccid paralysis. Some 9-10 can have diarrhea, but no one will develop flaccid paralysis. Out of 1,000, only 1 will develop flaccid paralysis. So, subclinical means without symptom recovery. No symptom and recovered. So they will not go to hospital. This only one case will go to hospital, and this will be the tip of iceberg. So the tip of iceberg represent clinical case who will come to hospital. And this hidden part of iceberg, this is representing subclinical case. Subclinical case do not have symptom, so they are also known as asymptomatic, without symptom. Asymptomatic case. Now, who will see the clinical case? Those who are sitting in clinic, medicine, surgery people, clinician will see the tip of iceberg. And who will see the hidden case? They say epidemiologist see the hidden case. So the hidden part of iceberg is seen by epidemiologist. This is all bullshit. Actually, these days epidemiologists or PSM people, they are also sitting in their AC room and doing research paper mostly. They are also not going door to door and searching for hidden case. So unless you are searching for hidden case, you cannot find those hidden case. But I hope you understand. To detect the hidden case, we should do active surveillance. We should go to their house and search for hidden case. So this is also iceberg phenomena. Iceberg phenomena do not occur in case of rabies, measles, tetanus, because in rabies, measles, tetanus, every patient will be in the tip. Everyone will develop symptom. Okay. Similarly, in neonatal rubella and pertussis also, iceberg phenomena is not seen, because in these 5 diseases, there are no subclinical cases. What are the 5 diseases? Revise again. Rabies, tetanus, measles, neonatal rubella, pertussis. In rest other disease, there are some subclinical cases, but not in these. Okay. So do remember these 5 disease name and iceberg phenomena. Now, coming on to the next question, sensitivity is defined as. Sensitivity is ability of test to identify true positive out of disease. But even if written true positive, this is the correct definition of sensitivity. Complete, not complete. Complete definition will be true positive out of diseased population. Out of diseased population, how many are true positive? This is known as sensitivity. Basically, sensitivity means ability to include. Like in your class also, there must be some sensitive boy or sensitive girl. Let's say someone had a breakup in your class. They will be ready with their shoulder. Come and cry here. So if I ask, will you allow boy and girl both to come and cry on your shoulder? If you said yes, it means you are a sensitive boy or girl, because you are including everyone. But if you said no, I will give my shoulder only to girls or only to boys, it means you are specific. Specificity means ability to exclude. You are excluding all the boys from your shoulder. So that is specificity. Okay. Sensitivity is including. And this is the definition of specificity. Ability of test to identify true negative is specificity. Now here, this true negative is identified out of non-disease people. Those who are without disease, out of them, how many are true negative? That is specificity. This option number C, which might confuse you, probability that the patient with a positive test has the disease, this is known as positive predictive value. And this last, probability that the patient with a negative test does not have the disease, this is known as negative predictive value. And in many exams, they ask you to identify the correct formula of these 4 things and do some simple calculation here. I will tell you in such a way that you will never forget for sure. Whenever you are writing the formula of sensitivity, remember the definition. Sensitivity is ability to identify true positive. So it means we will write true positive in the numerator, and then in the denominator, we will again write true positive, and then there is just opposite of that. What is the opposite of true? False. What is the opposite of positive? Positive ka opposite? Negative. So the definition of sensitivity is true positive by true positive and just opposite of that, false negative. This is sensitivity. You can multiply it with 100 if you want to get answer in percentage. Now, what is specificity? Specificity, as I said, is ability to identify true negative. So just remember true negative and you will never forget the formula. Here you will write true negative in the numerator, and then in the denominator there is true negative, and then just opposite of that. What is opposite of true? False. What is opposite of negative? Positive. So this is the formula of specificity. True negative by true negative and just opposite of that, that means false positive. And you can always remember it. Now when it comes to PPV and NPV, they have very simple formula. In NPV, everything is negative. It starts with true negative, and then in the denominator there is true negative plus false negative. And when it comes to PPV, PPV has everything positive in the formula. So PPV is true positive by true positive plus false positive. I hope you will not forget or confuse in the formula under exam pressure. And do remember one more thing, sensitivity and specificity are fixed for a test. They do not fluctuate, but PPV is directly proportional to prevalence of disease. If more people have disease, PPV of that test will be more. For example, if we are doing pap smear among sex worker who have higher chance of cervical cancer, then PPV of pap smear will be more. And if I am doing pap smear on normal female population in which cervical cancer is less, then the PPV of pap smear will be less in normal female, more in sex worker, because in sex worker, prevalence of cervical cancer is more. So PPV will also be more. Very commonly asked question. Do remember it. Okay. Now coming to the next question. The next question is that a woman came to PHC for regular follow-up during her second trimester. What is the dose of the tablet which you will prescribe? So we prescribe 60 milligram iron and 500 microgram folic acid. And we prescribe it daily. Daily for 180 day before and 180 day after delivery. Before and after delivery. And the color of the tablet which we prescribe is red. Okay. 100 was older tablet which we no more prescribe. And the dose of folic acid is 500, not 400. Okay. Now, do remember that the ideal time to test for random blood sugar in pregnancy is 28 week. We do the test in 24 to 28 week, but ideal time is 28 week. And the duration of maternity leave, we all know, is 6 months. But in one of the exam, they ask that is it 24 week, 26 week, 28 week or 30 week. So maternity leave is for 26 week and the salary which is given is 100% of the salary. They say 100%, but they cut the traveling allowance and other allowance there. Okay, so these are some of the questions which you should remember. One more thing I want to make you remember is that in Anemia Mukt Bharat, about which we are reading, the target is 3% reduction of anemia. But in case of Poshan Abhiyan or PM Poshan program, the target is 2% reduction in malnutrition. So 3% reduction in anemia and 2% reduction in malnutrition. These are the target which they can ask, you should remember. Okay. Now, the contamination of Panicum miliare. Panicum miliare is known as crotolaria. This plant usually grow in tribal areas, and in tribal areas, I still remember sometime while traveling, in the air you will listen this sound. Jhun 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 jhun. Jhun 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 jhun. In air this sound will be there. That's why, and this sound is coming from this plant. They have big kernel and a small seed. So when wind blow, it produces this sound. Jhun 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 jhun. That's why they call it jhunjhunia also. Crotolaria or jhunjhunia, with jhunjhunia. So this crotolaria, Panicum miliare, is sometime mixed with jhunjhunia seed. Jhunjhunia is the weed. And this jhunjhunia seed has the poison pyrozolidine and it causes endemic ascites. How will you remember the poison? Very simple. The disease is ascites. And ascites means pet ho gaya bada. And a pet, Hindi word, it means stomach. So the pet is swollen in ascites, stomach is swollen. P for pet, P for pyrozolidine. Sanguarine is the poison of epidemic dropsy. Epidemic dropsy. And they can ask you the question that if a patient have bilateral pitting edema and feature suggestive of congestive heart failure, bilateral pitting edema on leg, they can give an image-based question also from here. Bilateral pitting edema on leg and congestive heart failure symptom. This can be due to dropsy. How will you remember it? Imagine you are sleeping with someone of your dream. So, sleeping together, sang, or S for sung, S for sleeping. If you slept, rare chance, but if you slept, then due to sleeping, there will be dropping of eyelid, dropsy, sanguarine, sleeping, dropping of eyelid. And the edema is also pitting, dropping inside. So you can remember it all through that. As for sleeping, sleeping have dropsy and pitting edema. Beta oxalyl aminoalin, I hope you all know. This is BOA, which is the poison in neuroletharism. And in neuroletharism, main thing they will give in the exam is that patient is walking cross-legged, stepping on toe. Cross-leg walking is neuroletharism, and treatment for neuroletharism is vitamin C, which we give 500 to 1 gram, 500 milligram to 1 gram. Aflatoxin is the poison for if someone eat, they can ask this question, very high chance of this question going to come in your exam. If someone is eating contaminated groundnut or maize, contaminated groundnut they will give mostly. मूंगफली में दाना नहीं, हम तुम्हारे मामा नहीं. So contaminated groundnut or maize. And this is contaminated with which thing? Contaminated with Aspergillus flavus fungus. So that can lead to hepatocellular carcinoma, of course, of liver. And the poison is aflatoxin. Then one last poison you should remember is that sometime wheat or rye plant have black color claviceps purpurea. This claviceps purpurea, they will give someone eat wheat or rye with black color fungus on it. So this claviceps purpurea release the poison ergotoxin. And I am sure you must have heard that ergotamine group of drug are used to treat migraine. How they treat migraine? Migraine is due to abnormal vasodilatation. So ergotamine will cause vasoconstriction, and that will relieve the migraine pain. Now the same vasoconstriction occur with this claviceps purpurea fungus also, and that will lead to necrosis of finger, because due to vasoconstriction blood will not reach to peripheral finger and toes. So what will be the sign in this poisoning? In this poisoning, patient will have cyanosis or necrosis of finger. Okay. Plus, they can also have a symptom of hallucination and vomiting, similar to the hallucination occur also with LSD intake and all. So similarly here also hallucination can occur, vomitings can occur. Okay. So of toes and finger. So do remember these 5 poison, very frequently asked, very important area of question. Now coming to the next question. The next question is that in an employee state insurance scheme, which is false? Okay. So option 1 is extended sickness benefit is of 2 years with 80% salary. This is correct. And this has been asked in NEET already. Extended is for 2 years. Enhanced sickness benefit is not for 91 days. Enhanced sickness benefit is given when you cut the wires. Like you can cut my wire vasectomy, and you can cut female wire or my tubectomy. So which one is smaller? Of course vasectomy, because the wires and testes are already hanging below, so you can cut it easily. So in case of vasectomy, the leave which is given is only of 7 days. And in case of tubectomy, the leave which is given is of 14 days. And in both this thing, you will get 100% of salary. Okay, because you are doing it for the country. So that is enhanced. Don't get confused. So this was the wrong line. Enhanced is not 91 day. 91 day is known as sickness benefit. And this sickness benefit, when given, employee receives 70% of salary. So sickness benefit with 70% salary is for 91 days. As I said already, maternity benefit is of 26 weeks. And for medical benefit, because this is insurance program, whenever we take insurance, there is monthly premium which someone has to pay. So in that monthly premium, 1/8 is given by state government. So there are 2 wrong lines in this question. B is also wrong, D is also wrong. Because 1/8 is state government and 7/8 is contributed by central government. 7/8 is by central government. Along with that, 0.75% of total monthly premium is given by the people who are working there, employee, and 3.25% of total monthly premium is given by the manager, employer. So employer is the one who give 3.25, employee 1.75. So if you add, it will become 4%. 4% from there, around 12% from state government, and remaining 83% is from central government. So who is the main funder of ESI program? Central government. Okay. Similarly, in Ayushman Bharat, not all money is given by center. Around 60 to 70% is given by center, and 30 to 40% is given by state government. So Ayushman Bharat also have money coming from state and center both. Next question. You are posted in microbiology department, and the head of the department asks you to discard the culture medium. Not only culture medium, do remember, culture medium, culture plate. It is written in Park textbook that both of them, because they are microbiological waste, they will go in yellow bag. Now in yellow bag, cytotoxic drug vial will also go. But there is a very controversial question that where will you throw the vaccine vial? So my friend, vaccine is not a cytotoxic drug. And all the glasses and metallic implant, all the vial, they go in blue. So vaccine vial will also go in blue. Because in blue, we will first send the bottle for autoclaving where it will get sterilized. And then after sterilization, we can reuse it. So broken vaccine vial or normal vaccine vial goes in blue. But cytotoxic drug vials goes in yellow, and this is clearly written in Park book, so please trust it. Moreover, if I ask where will you throw the pacemaker? Pacemaker is again a metallic implant, so that will also goes in blue. If I ask where will you throw the cotton of the patient? Cotton used in wiping the blood of the patient. So cotton again being a soiled waste, that will also goes in yellow category, because I hope you know in yellow category 6 thing goes. Let's say I went outside after taking class and I had an accident, boom. After accident, I came to you for the treatment and you cut my leg, not side leg. Hai? So if you cut my leg and you have to throw it, you will dispose it in yellow, anatomical waste. All the blood which will come out through my leg cutting will also goes in yellow, liquid waste. All the antibiotics and expired drugs which you will use or something, antibiotics you will use, there, if some antibiotics is left or some medicine is left, after using, let's say you use 70% of the vial, 30% is left. All those expired discarded medicine goes in yellow. Then if you will take my blood sample for microbiology lab, all the culture medium, culture plate goes in yellow. Then 5th is the soiled waste. You use cotton or my blood make your bedsheet dirty, that soiled waste goes in yellow. And last, cytotoxic drugs, 6th thing goes in yellow. If I ask you where will you throw the gloves with blood? Gloves with blood or without blood, they will always goes in red, because red is for plastic waste. Similarly, they ask where will you throw the PPE kit? The original PPE kit which we used is of plastic, white color with blue color chain. And being plastic, PPE kit will also goes in red. So do remember, gloves with blood and PPE kit, again true controversy, they both goes in red. Okay. Now, in white, what we throw? Of course, we throw sharp there, but not all sharp. Like say Caesar. Caesar is sharp, but if we throw it in white, then we have to cut it into fine pieces and dispose it. But Caesar we can reuse. So Caesar will also goes in blue category, because it's just an instrument and metallic instrument goes in blue. So in white, what are the 4 things which go? Remember 4 things, which only 4 things goes in white. First is scalpel, because from surgical scalpel, if you're trying to remove the surgical blade, it can cause cut. So guidelines say directly throw a scalpel in white category. Second is the needle with fixed syringe, that will go in white. Third is needle of IV cannula, of suture, everything. And 4th is the surgical blades. So these 4 things goes in white only. I hope this revised all your biomedical waste thing, which I hope you already know, but a good revision never do a harm. है ना? So let's revise it. One more question which came from that topic was that where will you throw the plastic wrapper of syringe? So plastic wrapper of syringe has not been contaminated with patient body fluid. So it is still a garbage, and all the garbage goes in black category garbage bag. So black is not for biomedical waste. Doctor prescription and plastic wrapper of syringe goes in black. Do remember. Okay. Next question. What does CARE Foundation fund for? CARE Foundation fund for little children nutrition. ICDS, Integrated Child Development Services, which has Anganwadi program under it. They are funded by CARE Foundation. Injured soldiers in the war and disaster relief work, this is the funding of Red Cross. Okay. Sanitation work and National Institute of Health Administration is funded by Ford. How will you remember it? Ford ke haga. है ना? This sanitary work, है ना? Ford is the organization which fund all this sanitation work. And let's say someone Ford ke haga, someone did shit in this big amount. Then of course they need to take a bath after that. So this is National Institute of Health Administration, which is known as NEHAI. So Ford ke haga, phir nahaya. है ना? Ford for sanitation work and then NEHAI. Industrial and Agricultural Development and Cobalt Therapy Unit. This is the funding of Colombo Plan, which has been asked in past NEET exam. Okay. Along with that, you should also know what does Rockefeller Foundation fund. So Rockefeller Foundation try to make our foundation rock solid by helping us in doing research. Because if research is done in India, then all the drug patent will be by Indian name and we will earn millions of rupees. So remember, research and National Institute of Virology, these are funded by Rockefeller Foundation, rock solid foundation. Okay, so do revise it before exam. Let's add some more point here which you need to revise. UNDP, United Nations Development Program, this fund Sustainable Development Goal. USAID fund Malaria Program. Both of these has been asked previously. Then UNICEF. If you see the logo of UNICEF, there is blue color logo with mother and child. So UNICEF fund mother and child area, but along with that, UNICEF also fund Seed and Manure of Applied Nutrition Program. Seed and Manure of Applied Nutrition Program. Okay, because one of the work of UNICEF is to help in food supplementation. So they will give fund for Seed and Manure of Applied Nutrition Program. Applied Nutrition Program was a very old program, started around in 1980s and all, in which UNICEF thought we will open garden in school where they will grow fresh vegetable to be used by in midday meal. But do you think it is possible garden in a school? No. But still they planned for it, never worked. But still, you remember Seed and Manure of Applied Nutrition Program by UNICEF. Then who fund the family program? UNFPA, Fund for Population Activity. This fund our family program. What does it mean? Fund for population activity? Are they giving money for sex? No. They are giving population control activity. They forget to write control. Then two last thing. SIDA, Swedish International Development Agency, fund TB program. And DANIDA, fund eye program. How will you remember it? Netradan, eye donation. So eye dan, donation. Eye program DANIDA. And S for SIDA, S for sputum. TB program SIDA. Okay, that will fulfill this topic funding. And they ask question from it, so do remember. Which of the following is not a part of young child feeding practices? Can you guess it? Can you answer it? It's a challenge for you. Remember, early discharge is not a bad thing in US, UK at least. Mother will be discharged early from the hospital only if she is able to properly breastfeed the child. So early discharge means no complaint, and it's a good thing. Breastfeeding on demand means we do not wait for 2 hours. In between, if the child is crying, we again breastfeed him or her. Because you know the guideline, 20 minutes from one side, then 2 hours, and again 20 minutes from other side. But in between, let's say I am feeding my baby for 10 minutes, and the baby slept. So now I cannot keep him hungry for 2 hours. And in between, if he asks for it, I will again breastfeed. So this is also given. But hygiene practice is not a focus of baby-friendly hospital initiative or IYCF. Hygiene practice means prevention of infection. We never focus on that. Okay? Like we never ask the mother to wash the nipple before breastfeeding or wash the chest before kangaroo mother care. We only focus on feeding the child as early and as better as possible. If the child is properly breastfed, immune system will be good and they will fight with infection themselves. So prevention of infection is not a priority, do remember. Now, next question is that what is this life cycle being shown here? You can see the mouse here. And if the mouse is there, let's say rat urine they have written, that suggests leptospirosis. But they have not written urine. They just write mouse, no urine thing. And then they are saying about a tick also. There's a rat, there's a tick. Okay. And they have given this merozoite and there's a image here. Can you appreciate this image in this part? This is like a cross. This is known as Maltese cross. And Maltese cross occur in which disease? It occur in babesiosis. In NEET 2018, they asked this question. They gave the peripheral smear with Maltese cross and they asked who transmit the disease. So babesiosis is transmitted by ixoid tick or deer tick. Ixoid tick or deer tick, they look exactly like hard tick. Remember in hard tick, H for hard, H for head. So head will be visible in a hard tick. Okay, you can see the head here. And this ixoid tick or deer tick, they transmit 2 diseases. One is babesiosis, other is Lyme disease. Babesiosis is categorized by Maltese cross and Lyme disease is categorized by this type of red color lesion. This is known as target lesion. We also call it bull's eye lesion, saand ki aankh, target lesion. And that's look at target and all. And the scientific name is Erythrema chronicum migrans because this is red color, chronically there and migrating to outside. So do remember ixoid tick, deer tick with head visible transmit 2 disease. Lyme disease, babesiosis. Babesiosis will have Maltese cross. Lyme disease will have bullseye lesion, target lesion. Okay. Now, what are the disease transmitted by hard tick? Hard tick transmit KFD, Casimir forest disease, which is also known as monkey disease. It also transmit Rocky Mountain spotted fever and Indian tick typhus, and then tick paralysis, tick fever, that is also transmitted by hard tick. Okay. The causative organism for Rocky Mountain spotted fever is Rickettsia rickettsii. So I used to think while preparing in MBBS that Rocky is some adventurous guy who is climbing the mountain again and again. Rickettsia rickettsii. Okay. Anyway, you must have seen that movie, Salam Rocky Bhai, KGF. And, you know, in that movie, Rocky was also a hard guy, na? So this Rocky Mountain spotted fever transmitted by hard tick. And even if you shoot 6,000 bullets from 1 meter, none of the bullet will touch him. Such a hard guy. So that is the main disease transmitted by heart tick. Now, coming to the next question. A postgraduate medical student, someone like me, want to study the efficacy of a new drug in the treatment of hypertension. This is not my work, but let's say. So, which study design will be applied in this case? The best study design to know the efficacy of a drug is RCT, clinical trial. We give it to half of the people and then we compare the new drug with old drug given to another half of the people. Now, if they want to know the incidence, new case, then cohort will be the best. If they want to know the cross product ratio is the other name of odds ratio. Or let me tell you one very important thing. They will create this question that a study is done to know the congenital side effect of a new drug. So all the congenital side effect is best detected by case control study. Because if you know that there is a congenital side effect, then you cannot give it to the patient and just keep on observing that today 2 children born with anomaly, we should have stopped that study. You cannot do that. And you cannot give it to one group, let them take it like a cohort and just keep on writing that this side effect occurred. So cohort and RCT both are unethical to do if you are doing the trial for congenital side effect. Like thalidomide cause phocomelia. So you cannot do RCT or cohort on that case. In that case, you can only ask the question from the case, the mother of the child who had phocomelia in the past, and compare their history with control, the mother of the child who don't had phocomelia in the past. So you are comparing the past history, whether they took the drug in the past or not. This you can do. So remember, congenital side effect best detected by case control. Similarly, if they ask, what is the best study to detect temporal association? So temporal association, or sometimes they ask this question in a twisted way. Let me see whether you can answer it or not. Which is the best study to know natural history of disease? Natural history of disease. How can you detect it the best? As soon as students see the word history, they write the answer case control. But no, natural history of disease is same as temporal association, and that two are best detected by cohort study. In one of the exam, they ask, what does cause precede effect mean? Cause precede effect is the other word for temporal association. Okay. All these three are same thing. Cause precede effect, temporal association, and natural history of disease. And why they are best detected in cohort? Let's see. The point is, cause precede effect means परिणाम से पहले कारण. Okay, that is cause precede effect. So let me explain it to you with an example. Okay, let me take an example here. Why I am drinking this water? You can say, sir, you are drinking the water because you might be thirsty. That is a cross-sectional observation, or that is based on your personal experience. But the real reason why I am drinking water is to explain this concept to you. Now, how can you know that I am drinking it to explain this concept? If you have attended my face-to-face class or some online class in the past, you must have known that whenever I explain this concept, I drink water. So if you have done follow-up, observed me from past till now, then you know the reality. And in cohort, we do follow-up. So only by follow-up, we can know the reason which occur before the outcome. Only by cohort, we can know the temporal association or natural history of disease best. Okay? So that is the reason. I hope you understand. It's a very simple thing. All these three things are best detected in cohort study. And why they ask so much questions from this temporal association? Because temporal association is the most important Hill criteria of association. Hill was a scientist who said that if two things are happening together, it does not mean one is causing the other. Correlation does not imply causation. For example, in India, vaccination of COVID is increasing and cases are coming down. But it does not mean that vaccination is causing low cases. Because there are 5 countries in the world like US, UK, China, Israel, Seychelles, 5 countries where vaccination was more than 90%, still cases of COVID were high. So that means vaccination is not causing low cases. That means two things are correlated, but it does not mean causation. And to tell causation, we need all these criteria, out of which strongest criteria is temporal association. And remember, in Hill criteria, sensitivity is not a criteria. We never include sensitivity in Hill criteria. And in Hill criteria, there is temporal association, then strength of association, which is best detected by relative risk. Then there is specificity, coherence. Then there is biological gradient, biological plausibility, consistency, then experimental study like RCT and analogy. These are the Hill criteria of association, and you can see there is no sensitivity in it. We have specificity as Hill criteria, but not sensitivity. Okay. So coming to the next question. The next question is about APGAR score. You took an APGAR score of a newborn child. Which type of data it is? So all score and all scale, these are ordinal data. Ordinal data means there is order between them. But when you subtract two order, the difference is not same as subtracting other two orders. Like, let me explain. Like I am saying pain scale. Which type of data? Ordinal data. Okay? Pain scale. And suppose you came and slapped me like this. You ask how much pain you felt. I said 1/10. And then some unknown person came and slapped me and asked how much pain. I said, let me make you feel the same. And I said I felt 8/10 pain. So 8/10 is not 8 times of 1/10. These are just subjective feeling. If you take the difference of 10/10 to 8/10, and this difference is not same as 3/10 to 1/10. The gap between two digits are not comparable. They are just arranged in order. Let me explain it in another way. APGAR score of a child, suppose it is coming 2/10. This child is difficult to survive. And when I make it 4/10, still the chances of survival is not so good, but still better. So this is two reference point. Now if I write 8/10 and 10/10, these two, the difference between 8/10 and 10/10 is almost negligible. There is no difference. 8/10 is also normal, 10/10 is also a normal child. But 2/10 and 4/10, that difference matter a lot. So the gap is not equal, that's why they are ordinal. Remember, ordinal and nominal, they are for qualitative data. Qualitative are those data which you cannot measure. You can just classify them into category. That is why qualitative is also known as categorical, because they can just be classified in category. For example, can you measure pain? No. You can only categorize it 1/10, 10/10 like that. So these all are qualitative data. For quantitative, we use interval ratio. What is the difference between them? Interval don't have true zero. No true zero. No true zero means when zero come, they are still present. For example, interval have this example, temperature in degree Celsius. Many of you have felt 0 degree Celsius in your life. Tell me, at 0 degree, temperature is present or gone? At 0 degree also temperature is there, na? So that means temperature do not have true 0, because at 0 temperature is there. And I was taking some class and some students studying in remote part of China where cold temperature is going in minus 70, 80s and all. They told me that, sir, in our area, sometimes it is so cold now that even if we urinate, it will freeze before falling. What do you think? Are they telling a truth or are they throwing big? They can be throwing. So, remember, temperature is interval because 0 is not true. And except temperature, all the things which we can measure like BP, HB, height, weight, these all are ratio, because at 0 they are gone. No, you cannot find a person with 0 BP. He's gone. So all the things with real 0 are ratio and temperature is interval. How will you remember it? Very simple. In our life, all the vacations which we got, like summer vacation, winter vacations, except Corona time, other time, all the vacation are due to temperature, na? So who gave us interval of life? Temperature give us interval of life. So temperature is interval, rest are ratio. Okay. Now, coming on to the next question. Which of the following is not responsible for hardness of water? Remember, bicarbonate, they cause temporary hardness. And this temporary hardness goes away by boiling. If you boil, temporary hardness will go. Magnesium bicarbonate is also temporary hardness. Calcium chloride lead to permanent hardness, which does not goes by boiling. And the best method to remove both type of hardness is ion exchange method. Answer to this question is calcium carbonate. Only 4. D. Calcium carbonate, and there is one more thing which you should know, calcium gluconate. These two things are not responsible for hardness of water. You must have observed that sometime when you boil the water, white color thing deposit in the vessel. That white thing is calcium carbonate. So calcium carbonate, calcium gluconate does not lead to hardness of water. Okay. Now, this we have already discussed the question of diarrhea management, and then we discussed pneumonia management also. And before moving ahead, you should know the compositions of WHORS, which is very simple to remember. First, this part is very simple. Sodium is 75 and glucose is also 75. Okay. Then, if you add 2Cl, see, there are 2Cl. One is chlorine, other is citrate. If you add C and C, this double C will become 75. So sodium, glucose 75, C plus C 75. Of course, out of them chlorine is more. And then last is potassium, which is 20. Total become 245 milliosmol. So mainly they ask this milliosmol thing. Sometimes they can ask this gram thing also, which is again easy to remember. How? See, 2.6 is sodium chloride and 2.9 is trisodium citrate. How will you remember it? Just mug it up. I don't have any method to make it remember, but just remember sodium chloride is 2.6 and then citrate. Citrate is triple. C is anyway alphabetically A, B, C, third letter. So 2.6, then add 0.3. It will become citrate, 2.9. Then 1.5 is potassium chloride, and in this 1.5, if you add 3 in between, it will become 13.5. That will be glucose. So 1.5 is potassium, 13.5 is glucose, and then you will remember this part also, 2.6 and then citrate 2.9 gram. Okay, total something will come out and that will be the answer. They never ask this weight of total. They only ask osmolarity of total. New one have 245 osmolarity. Previous ORS has 310 osmolarity and something like that. But here 245, they ask only this new one. Next question. A patient presented with this. What is this? You can see this is the bullseye target lesion, which occur in which disease? Lyme disease, transmitted by deer tick or ixoid tick. Okay, they transmit it. Sandfly transmit oriental sore, Oriya fever, and Kala Azar. So to remember the disease transmitted by sandfly or phlebotomus, you just need to say this word with me. Oh, Kala Azar. Oh, Kala Azar. If you say it with me, oh, Kala Azar, you will remember the disease. Oriental sore, Oriya fever, Kala Azar by phlebotomus. Tissy fly is also known as Glossina palpalis. And they are talking about Palak palpalis. And Palak is related with sleeping. So CC fly, Glossina palpalis cause sleeping sickness. Soft tick transmit Q fever and relapsing fever. So the mnemonic is QRS complex. Why it is complex? Because in our time it was a very common question. Q fever is also transmitted by air. Very rarely by soft tick. And relapsing fever is transmitted by louse, head lice. Head lice transmit 4 diseases: pediculosis, epidemic typhus, relapsing fever, and trench fever, which is also known as Quintanilhac fever. So 4 diseases: pediculosis, epidemic typhus, relapsing fever, trench fever, or Quintanilhac fever, transmitted by louse. How can you remember it? The mnemonic is very simple. Put. Remember in your old days when you used to take out the louse and kill it, it used to produce a sound of put. So the mnemonic is also put. Yeah? And that is the way to remember 4 diseases transmitted by louse. So louse also transmit relapsing fever. And Q fever also transmitted by air. And they are also transmitted by soft tick. So that's why QR, 2 disease by soft tick QRS. And it is complex to remember because they are also transmitted by some other agent. Okay, dear? So do remember it. Now, in which of the following phases does the birth rate start declining in the demographic cycle? So, birth rate start declining in 3rd phase. If you look at the phases of demographic cycle, these are the first phase from which 3 questions can come. First phase is high stationary. So in this first phase, high stationary, birth rate is high and death rate is also high. Let's say this is the death rate, is also high. High stationary. And I think our parents were also high at that time. In the second phase, birth rate is still high. In the 3rd phase, birth rate is start decreasing. So it start decreasing in 3rd phase. 3rd phase is known as late expanding. Okay. And if they ask in which phase growth rate is maximum, so growth rate is maximum in 2nd phase, which is known as early expanding. Because in 2nd phase, birth rate start decreasing. So here. And what is growth rate? Growth rate is the gap between birth rate and death rate. So you can see the gap is maximum here. So growth rate is maximum in late half of early expanding. This part, growth rate maximum. And when the birth rate start decreasing in the 3rd phase, then this gap you can see is decreasing. So growth rate is start decreasing here. In early phase of 3rd phase, early part of late expanding, early part of 3rd phase, growth rate start decreasing. Now, if they ask in which phase growth rate is maximum, so in the 4th phase, growth rate will decrease further. It will be low. That's why it is low stationary, because here everything will be low. Birth rate, death rate, both will be low. But in the 5th and last phase, which is declining, birth rate become much lower than the death rate. because we cannot decrease the death rate. People will die after some time, but birth rate become less than death rate. That's why population start declining. And a lot of European country and Japan are declining. So in which phase growth rate is negative? Negative in declining. In which phase growth rate is minimum? Minimum in fourth phase. In which phase growth rate start decreasing? Early part of third phase. In which phase growth rate is maximum? Late half of second phase. And India belong to which phase? Late expanding, third phase, India belong. So do remember all this question which come from this topic. Thank you. We are done with all the question of CBoT. Keep rocking. Focus on your daily target and finish it. And you will be ending with a satisfied mind. Even if you finish 70-80% of your daily fixed target, don't forget to appreciate yourself. Because self-appreciation will keep you happy, confident and motivated. And when you are happy, confident and motivated, your performance increase in every area. Okay? So see you next time. Till then, hasta la vista, das vidania. Thank you so much. Bye-bye.
Hello, welcome students. So today we'll be discussing these dermatology questions. Here you can see that in the first question they are saying examining the cell connected by adhesive structures necessary for skin strength in a patient with a skin rash which are connected by desmosomes. Now, do you know what are desmosomes? Desmosomes are the intercellular structures which help in attachment of two keratinocytes. So if this is one keratinocyte and this is another keratinocyte, both these are attached together via desmosome. So which cells are connected by desmosomes? Yes, keratinocytes, and that is what they are asking, that keratinocytes are the important cells and they are connected by adhesive structures, that is desmosomes. Okay. 41-year-old gardener presents with multiple painless nodules. So painless nodules in a gardener. Ulceration on the right hand and the forearm as shown in the picture, and in the picture you can see that there are multiple lesions which are present. He reported a history of thorn prick, so there is some plant injury. At the same site 3 weeks ago, on examination the nodules are tender and draining pus. No lymphadenopathy is noted. What is the probable diagnosis? Now you know that there is one condition known as rose gardener's disease which is known as sporotrichosis, and it is very common in gardeners, and here these nodules are formed and they are formed along lymphatics, so they are generally present in linear fashion. So such lesions can be seen in sporotrichosis. So sporotrichosis is the answer here. Patient presents with recurrent painful nodules, abscesses in the axilla, in the groin area also. Examination revealed multiple inflamed painful nodules and scars. Which staging system is used to give in the given disease? Now this is which disease? Yes, this is HS, that is hidradenitis suppurativa, which commonly occur in axilla, and it can also be seen in groin area. Why? Because it is a disorder of apocrine sweat glands which are commonly present over axilla and groin. And in this condition what happens, that there are different types of lesions which can be seen. Like here over axilla you can see that these painful nodules or abscesses are present. So patient can present with these abscesses. Okay. Now if these only abscesses are present without scarring or sinuses, then we call it stage 1, and this stage 1 is of Hurley staging, that is Hurley stage 1, where abscesses can be seen without scarring and sinuses. But if along with these abscesses which are coming up again and again, so if there is recurrent abscesses with scarring or sinuses, then we call it stage 3 and stage 2. And stage 3 is if there are interconnecting sinuses and there is diffuse involvement. So if the involvement is large and in between these abscesses there are interconnecting sinuses and scarring, then we call it stage 3. So these are the 3 stages of HS, that is hidradenitis suppurativa, and this is known as Hurley staging system, while PASI is full form is psoriasis area severity index. So this is used in cases of psoriasis. Score 10, you can see you are scoring which patient? 10 patient, that is toxic epidermal necrolysis. So this is seen in score 10 patients, that is 10 patients. And dermatological life quality index is done in various skin diseases to see that how this skin disease is affecting the life of the patient. Okay, so the quality of the life, like in cases of acne. Now, after observing a worsening of her skin lesion, a 38-year-old lady with a history of psoriasis visited her dermatologist. She just started taking multiple drugs for unrelated conditions. The doctor considered these drugs might be responsible. Which medication from the list below doesn't cause psoriasis? So you know that psoriasis is a multifactorial condition and there can be various factors which can aggravate psoriasis. Like psoriasis can get aggravated in winters. So there are various environmental factors like cold environment can aggravate this condition. Then the lifestyle changes also, like smoking, alcohol, can also aggravate psoriasis. And similarly, there are certain drugs which can aggravate psoriasis. These drugs can be beta blockers, they can be ACE inhibitors, they can be lithium. So all these are the drugs which can aggravate psoriasis, but not thyroxine, that is levothyroxine, and this doesn't affect psoriasis. So these are the drugs which can aggravate. So there are multiple factors which can cause psoriasis and some can aggravate it, like winters, like smoking, like alcohol, and certain drugs. There are other drugs also like terbinafine, like interferon, like tetracycline. So there are multiple drugs which can aggravate this condition. 24-year-old male presents with numerous flat warts. So numerous flat wart-like lesions are present on the face, on hands. He reports that these warts have been slowly growing in size and number for the past year. Physical examination reveals multiple flat-topped, slightly raised, well-demarcated warty papules with rough surface. What is the most likely diagnosis? Now in the second image you can see that there are a few light-colored, depigmented or hypopigmented lesions also. So do you know any condition where wart-like lesions along with hypopigmented lesions are seen together? Yes, this is one viral condition known as epidermolysis verruciformis, where the lesions mimic plain, that is flat warts, and hypopigmented lesions of pityriasis versicolor. So if the clinical presentation mimics these two conditions, then probably you are dealing with a case of epidermolysis verruciformis, which is caused by, so this is a viral condition and it is caused by human papilloma virus, commonly human papilloma virus 3 and 5. So this is the condition which can cause a picture resembling warts as well as versicolor, that is light colored lesions. Verruca vulgaris are common warts. They are generally rough surfaced. So they are not plain topped generally. They are rough surface lesions. Normally present over dorsum of hand. Molluscum contagiosum caused by pox virus. The lesions are not plain topped. They are dome shaped with central umbilication. And seborrheic keratosis is generally seen in old individual because this is a degenerative condition and it is not associated with hypopigmented lesions. It is flat lesions and these lesions have a characteristic appearance that is stuck on appearance. So that is all for today. Thank you very much.